Hello, David Sweeney, chiropractor from Dublin to Chiropractic. In this video, we're going to talk about tennis elbow, which is a repetitive strain injury in the elbow, in around this part right through here. It's often caused by clicking the mouse a lot, or holding heavy objects, or weight training, or playing tennis, obviously. So for me personally, I've been struggling with this problem for many years because as a chiropractor, I need to grip and push on things, and it creates a tremendous strain in that region for me. So there's a few things that I need to do on a regular basis to maintain this and keep it at bay. When it gets bad, I need to go to town on it so I can fix the problem and get back to work and treat my patients. So I've never had one day off with this repetitive strain, although on some days it's been very, very challenging. So let me demonstrate all of the different techniques that I use to help resolve this, and I hope you find this really, really beneficial, especially now that we're in lockdown and we can't get to anyone for treatments at the moment. Okay, so you can easily identify the muscle by just rolling over it with two fingers. I can tense the forearm, and I can see it there. Tense the forearm. There. The radial head is just above it. And if you've ever been adjusted by me, you'll know that's what I pop. So I want to create rotation in the radial head, because the radial head sometimes gets a little bit stuck and doesn't allow the wrist to do this action. Therefore, we need to take it into this direction and manipulate that forwards. Find that muscle just below the bony part of the radial head. For me, it's right there. Super tender. And it's quite taut. So what I'll begin to do is simply pull through the full length of the muscle. Pretty basic, pretty easy, like so. What makes the most difference for me is to simply come in and do this cross friction massage, like so. And I can do that over the really tender point of the muscle for 2, 3, 4 minutes at a time. It's actually quite a bit of work on this hand, so sometimes you'll need to take some breaks. You can do a more circumduction type of movement through the muscle if you wish. And I like to work all the way down through all the areas of this muscle belly that are very tense and tender, but we'll always find that most of the trouble is higher up into the elbow, right here. Boom. Oh my goodness, that is bloody painful right there. And I am just basically destroying these fibers, rolling across. It's called friction massage, just like that. Okay, now when that's starting to feel a little bit looser, I'm going to grab the Rolflex here, and this horrible mean looking instrument, rather medieval looking torture device here, is going to really provide a ton of pressure, far more than this hand can do. So this can get a little bit of force. I can definitely massage the muscle and help it a lot, but this is far more effective. So I just place it on my knee like that. Open it up. I can calibrate it down through here like so. That might be a little bit too tight for me, so I'll put the hand through and a clamp. I'm going to clamp that muscle, and then I'm going to pull through. And you notice that finger went a bit crazy there. So I'm going to pinpoint the can you feel it? See the muscle flick right there? And boom, caught it right there. I'm clamping hard, and we pull through like so. And I just keep repeating and repeating and repeating until I'm getting good mobility, good range of motion back in through the wrist and an alleviation of the strain higher up. Now I'm going to drop it down a notch like so, straight through again, and now, oh my goodness, that is insane, right through there. Now what's incredibly effective is to catch a nodule, which is just a bunched up really stiff part of the muscle, and clamp it down and hold the pressure on it. Maintain pressure. You can see how strongly I'm squeezing on that now. Simply maintaining pressure through here until that feels better. Okay, until it relaxes out. Remember to try to keep your hand as relaxed as possible through this. Like so. So this instrument has been a lifesaver for this repetitive strain that I get. So after we do some of the deep tissue work, what we then need to do is stretch. And by far the most effective stretching technique I found is to keep the fist closed like this, keep the knuckles all closed and tight together, and then with this hand we come in and we're going to stretch it like that. Okay, this doesn't work for me. It's not taking enough of the tissue into the stretch. It just won't create the deep stretch that I want it to. So if I zoom back down, I'll show you that now. So I'm going to close my fist, I'm going to wrap around like that. Okay, just like that. And what's super interesting is I can clamp the wrist down into this position and then move the hand away like that. And that really, you can just see all the muscles there getting just totally stretched apart. It's a fantastic stretch, and a great tip. If you can hold that for 1 or 2 minutes, it's going to free this up nicely. Here's another tip though: pump it. Don't be afraid to move into more extreme ranges. Now if you're getting a lot of wrist pain up in here, that's going to be a little bit too difficult for you. But if all the trouble's down in through here, I would go ahead and just try to get a little bit more motion in, repeating this, 30-40 times, and that's really going to free that up nicely. But you'll know if you've come into me with this problem, look at your shoulder, neck, middle back, all of those postural issues. We adjust the elbow most likely. We can come up and do an extension adjustment and also do a rotation adjustment through that radial head, but also the wrist is very often affected as well. So don't be afraid to come in this way and stretch the underside of the musculature as well. So we can go this way and we can go this way. And you may also want to do the wall stretch for that, which is basically placing the hand against like this and then turning away. Do you see that? So you turn the body away. Very good deep stretch for the inside part of the arm through here. Okay, so what we want to do then is do a little bit of strengthening with a rubber band. Nothing too fancy, pretty basic. I'm just going to step on the band with my foot like this, and then I'm just going to raise up. Pretty simple, supporting right under here. 3 sets of 10. Underneath. Same thing. And in this position, up towards the head. About 3 sets of 10 for all of those. Get the muscle really lax, stretch it out, create a bit of that strength, and it will feel a whole lot better through there. Now, you might need to ice the area. What I found is when I do some deep tissue work into that muscle, it can be incredibly sensitive afterwards. Sometimes it's actually kept me up at night. It's been so painful. Now, personally, I don't take any anti-inflammatory drugs. You've probably heard me say that before. There's some research that shows that the side effects may not be worth it. So I use a more conservative approach, and that's with some ice. So I just grab a bag of frozen peas, something like that, and just pop it straight on the area, cover it with some kitchen roll. Ice will burn your skin after about 15 minutes, sometimes even 10 minutes. So you need to actually cover it with a tea towel, or I prefer kitchen roll because it's not as thick. It's going to let the ice penetrate down into it. And the idea here is to reduce inflammation. There's a theory that if we can reduce inflammation, it can help with the pain first of all. So if you're struggling to sleep or you've overdone it with your deep tissue work, I'm a big advocate for deep tissue work. And if you've kind of overdone it, you're going to really feel it. It's going to feel extremely sensitive and it's going to throb. Also, if you've overdone the deep tissue work, when you press into it, it's going to hurt as well. So icing, 15 minutes with a frozen bag of peas right over the area. Repeat it 2 to 3 times per day. Leave about a 2-hour window between each icing session is absolutely fine. Now let's talk about some dietary factors. I said on the last video, a few videos ago, vitamin D3 is extremely important, and it can cause all sorts of musculoskeletal sensitivities. So you need to get exposed to sunlight, direct sunlight. So the sunlight is the greatest vitamin D3 producer. So for example, I had a run today. I was out for about 40 minutes, something like that. And that was at 12 o'clock. So the theory is I got 20,000 IU of vitamin D3 today. So I won't take my vitamin D supplement today, so I don't need to. But on days that I'm not outside and I have not been exposed to the sun, I'll take 2,000 IU per day. You can also get testing kits to check if you're insufficient or deficient. So if you have a musculoskeletal issue that's very chronic and no matter what you do, it won't go away, I would advise you to go ahead and get a vitamin D3 test to see if you're insufficient. And it's been linked to all sorts of health problems, very, very serious health problems. So it's vitally important for the health of you and your family to make sure that you are getting your correct levels of vitamin D3. The other thing, omega-3 is going to help suppress the inflammatory mediators of the body, and also turmeric. Another thing is we're starting to understand that using or having a diet that's full of grain is an inflammatory mediator also. So you can look at the Deflame guidelines for more information on that and how to change your diet as well. So yeah, if you're definitely getting problems like this that are just really persistent, it's probably related to your work, your diet, and maybe your vitamin D3 exposure, and as well how you're managing it from day to day. So never forget that the human body needs maintenance. Just think of your body as a vehicle, and you need to learn how to maintain it. I get adjusted regularly from my chiropractor, and I also do self-directed deep tissue work and stretching and activation work, and I also try to keep quite fit to get all the immune benefits and other health benefits for that as well. So hope you enjoyed the video, and let me know if you have any questions in the comments below, and I'll be sure to get back to you. And have a great day. Cheers.